Putting on surgical mask. Perform hand hygiene before putting on mask. Make sure the metallic strip is facing upwards. Tie the upper strings at the top of the head with a butterfly knot. Tie the lower strings at the back of the neck. Fix the metallic strip securely over the bridge of the nose. Ensure that the mask fully covers the nose, mouth, and is stretched gently over the chin and fits snugly over the face. Change mask every 4 hours or if it becomes moist or damaged. Do not hang the mask beneath the chin area. Removing surgical mask. Perform hand hygiene after removal